Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now, here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 344 of the Ask Dr. Angela podcast. Today, we are continuing our menopause series, and we're talking vaginas, menopause, and today we're focusing on non-hormonal and natural options to treat menopausal symptoms. I have the esteemed pleasure and honor of welcoming Dr. Alyssa Dweck. She is a board-certified gynecologist who provides care to women of all ages, and she has a special interest and expertise in female sexual health and medical sex therapy. She is the Chief Medical Officer at Bonafide Health, and she's an expert in the menopause space, and her focus is on non-hormonal natural ingredients to treat menopause symptoms. So first of all, welcome. And let's just jump right in. I just recently just asked you this literally, but how did you get into this space of kind of non-hormonal and natural ingredients to treat menopausal symptoms? What led you to that space?
Yeah, so I guess it's been a long and winding road, as they say. So similar to you, Dr. Angela, I trained in OBGYN. I spent my 25, 26 years delivering babies, being up all night. And then, as I'm sure you've experienced, your patients start to age with you.
Yes.
So I stopped the middle of the night deliveries and really started to focus on, my more aging population of
Sure.
patients. And actually, I was introduced to the Bonafide lineup of products through a rep who came to my office to introduce me to some non-drug, non-hormonal, herbal type supplements and devices that were really making a big splash in the menopause space. And to be fair, and my nurse will probably hear this and hit me over the head, but our rep was a super handsome gentleman, and I think my nurse had a little crush on him, so she invited him to come and detail me quite frequently. So long story short, I really became quite interested in the lineup, introduced myself to the company, started out by just consulting with them, and
Sure.
then really moved forward into becoming their chief medical officer. So it's been terrific and really a wonderful alternative for people who want to avoid hormones or who can't take hormones.
Sure. I have quite a few of the Bonafide products in my office, and I have to say it's been a nice option because one of the things that I'm actually finding is that more and more women are looking for something a little bit more outside the box, if you will. Not everyone wants traditional hormone therapy in that sense, whether, people just want something, more air quote natural, or certainly sometimes they just don't have the ability to take those things because of, medical contraindications that they may have. So one of the things that I'm prescribing actually a lot of, and that I'm going to have you speak to, is the hyaluronic acid based treatment for, genital urinary syndrome of menopause, also formerly known as vaginal atrophy, dry vagina. How is it that you are finding, can you just give us an overview of hyaluronic acid, how it works, and how we are using this to treat, vaginal atrophy as opposed to traditional estrogen therapies?
Yeah, of course. So, this is probably our most iconic product. It's called Reverie.
Hmm.
Reverie is essentially made of a moisturizer that is found in nature and found in our
Yes.
bodies at all, but it starts to decline in production with age. So, the Reverie is a little insert that goes into the vagina. So it's a little less messy than a lot of
Hmm.
the gels and creams that are moisturizers and also available. The other really definitive and defining thing about Reverie is that it actually has the highest dose of hyaluronic acid available in a vaginal
Hmm.
insert. So I usually advise that women use this at bedtime or before they lay down 2 to 3 times a week so that it gives an opportunity for this insert to dissolve, which occurs over about a half an hour. And it really, after even 9 days, we have clinical studies to show that it really enhances the moisture in the vagina. There are no other active ingredients in
Hmm.
Reverie, so it's just hyaluronic acid and these semi-synthetic glycerides, which basically hold it together. And
Right.
we've really had wonderful success with this. Of course, minimally absorbed vaginal estrogen is all the rage, whether it's in a ring or a tablet or a
Hmm.
cream. And we realize this, and some people, prefer to use vaginal estrogen. We were so interested in seeing how Reverie worked in comparison to
Hmm.
estrogen that we actually have a study that was done at NYU in New York
Hmm.
by, several MDs, some in the urology department and some more gynecologically focused. And they did a head-to-head trial,
Hmm.
randomized but open label, of half the women using estrase cream or 17 beta
Yes.
estradiol cream in the
Uh-huh.
vagina twice a week as directed on that usual package label, and then Reverie twice weekly. And in fact, the results were so promising because really there was equal efficacy and
Hmm.
safety with both products. So we really, really feel very comfortable with this one, and we have a lot of experience with it, of course.
I'm really happy that you actually quoted that study because I was actually going to ask you about that if there were
Yeah,
any head-to-head studies comparing, satisfaction with Reverie, as opposed to using, estrogen.
yeah,
Certainly, one of the things that I hear a lot of patients mention with regards to traditional estrogen type preparations is just the messiness that can sometimes be associated with using, a cream preparation. So this certainly is a nice alternative, and I'm actually thrilled to see, the head-to-head studies and just that a lot of patients really and women in general
yeah.
just are getting a lot of benefit from using it. So it's nice to have just another alternative, kind of, if you will.
Absolutely. We were also really thrilled to have this study show equal efficacy because, even though there is thought that we can use vaginal estrogen for even our breast cancer
Sure.
survivors, there are still so many women who are really hesitant to do that.
Yeah,
And quite
exactly.
frankly, many, many providers who are also hesitant to provide this,
Hmm.
even if it's sort of the last ditch effort. But look, these are women who are suffering, and you know this. But this particular study compared them head to head, and women had equal vaginal pHs that were measured
Right.
after 12 weeks, equal comfort and relief from sexual discomfort. So overall, it really was a nice trial and well run.
I think it's a great study. And like you said, even a lot of practitioners in our own communities just aren't aware of like the facts and are afraid to prescribe certain treatments to treat,
Yeah.
various menopausal symptoms that women are experiencing, which leads to actually, my next question for you, with regards to educating, more providers and training. What's being done on that front? Can you speak to that?
Yeah. And in fact, this brings me back to your original question of how did I get involved with Bonafide?
Hmm.
Before I went to medical school, I actually did my master's in human nutrition because I've
Wow.
always found that to kind of be the basis of all, something that just
Sure.
truly interested me. And frankly, we don't get any training in nutrition really when you think about it in medical
Mhm.
school. And we get even less training in menopause, while we're in residency, busy, learning how to
Right.
operate and doing deliveries and all. So I think that that's been particularly helpful. As far as educating now, I mean, I think that Bonafide surely on its own has a website full of, really educational blogs that are all medically vetted. We have, different experts who will comment on blogs or content so that we get lots of different perspectives. And so I think we're all about education there. I think on a more global basis, menopause is on the map, as they say, it's a really hot topic right now. So we are having that conversation, and the more the word gets out, the better.
Yeah, and so many women are in this demographic, and this is frankly where most women spend most of their lives, in this age range.
Yeah.
So, to not have, research being done, in this particular phase of life, or, even, various products available to treat the various symptoms of menopause, frankly,
Yeah.
is just, it's really unacceptable. So, I mean, it's really nice to see so many more providers and to see so many more now advertising. No one was talking about menopause, a couple of years ago, and now it's everywhere.
Yeah. Yeah. I think we also can thank that the advent of telehealth, which, because frankly, so many women who are coming in for menopause consults and, treatment of their symptoms and whatnot have already had their gynecologic care. So they don't
Yes.
necessarily need an exam. So, telehealth has been helpful to really be able to have a lengthier conversation about different women's concerns,
Sure.
where it's not the big rush 20 minutes in the office where, you have to do an exam and a pap smear and to make sure they've had
Right.
all their studies and talk about, general medical conditions. So there, I think that's been a very helpful thing in the menopause space as well.
Right. So I'd like for you to speak to some of the other um, treatment options that are kind of under the bona fide umbrella, because certainly,
Sure.
with menopause, everyone thinks, painful sex, irritated, dry vagina,
Yeah.
um, bladder symptoms, hot flashes, night sweats, increased risk of infections. And certainly some of the other things that, I prescribe a lot of certainly is the Clear V,
Yeah.
which is for the vaginal microbiome. And I've used a little less, but I'd also like for you to speak to, you know, um, the Relizin, which is, the treatment option that you all offer for hot flashes. But,
Sure.
I get BV all the time. I'm getting yeast
Yeah.
infections all the time.
I know.
With the decrease in estrogen levels and the effects that it has on the vaginal microbiome, can you speak to that and how
Yeah.
the product that you all offer kind of helps
Yeah.
with that?
Yeah. Of course. There are a lot of skeptics in this realm and this conversation. So
Yes.
let's talk about Clairvy specifically.
Yes.
This is essentially a probiotic that has safety and efficacy trials around it to help with vaginal health. Now, what does that really mean? Because it's kind of a catch-all statement. Clairvy contains 2 strains of lactobacilli, so the good, lactic acid producing bacteria for the vagina and typically present in the vaginal environment, which of course Lactobacillus acidophilus and rhamnosus. It also contains a prebiotic called lactoferrin. It also is a very unique looking capsule. So for people who can't see the capsule, it's essentially a capsule in a capsule. And this is proprietary and really helps the probiotic strains to traverse the GI tract to make it to where it needs to really be helpful in the vagina. And we actually do have studies to suggest that when you take Claire V, which is given for 15 days consecutively of each month, when you take it for 15 days and do vaginal cultures to see what strains of lactobacilli are there, we do recover and see growth of the 2 strains in Claire V, not only at day 15, but at day 21, so a week after completing your month's worth of Claire V. So we do know it gets to where it needs to go. The outer portion of the capsule is surrounded by folic acid. So we know that, women
Sure.
are often deplete in this particular water soluble vitamin. We have information and studies that show that Clairvy is helpful for several reasons. The first and primary reason is to help with vaginal odor. I don't know about you, but my practice is full of people who are coming in with strange vaginal odor,
Yes.
usually the fishy variety.
Yes.
Sometimes we pick up an infection, BV or whatnot. Sometimes
Right.
we don't and kind of just chalk it up to the change in pH that's
Right.
occurring due to low estrogen. Either way, we have a study that reveals that within 2 weeks, women who reported odor and didn't have an infection took Clairvy and had an improvement in their odor. And the most notable results were seen after 6 months. So we really have a very nice track record with that. And patients that I have on it have been really pleased because this is such a distressing
Yeah, for
symptom.
sure.
Yeah.
For
The
sure.
two other studies I thought I would just mention briefly. One is in women who are prone to recurrent BV, and one is in women who are prone to recurrent yeast. And we
Yes.
do have studies that were done suggesting that those who are treated for those two infections in the classic medicinal ways,
Yes.
but also use an adjunct of Clairvy, have lower recurrence rates of symptoms. So lower recurrence rates of discharge or itching or irritation. So helpful to know. So my patients on this
Yeah.
are very happy. And this seems to be unique to Clairvy that it's so specific for the vaginal microbiome.
And quite frankly, it's really kind of refreshing to be able to specifically say, take this probiotic for this. Because, in the past, people are like, oh, just take some random probiotic, but nobody really could give any guidance. So it's
Yeah,
nice
I
to
so
have
agree.
something. Yeah.
I really agree. I mean, listen, there are great gut probiotics. People
hmm
do very well on them, but
Exactly.
I don't know that they could help the vaginal microbiome because I don't have any studies to really like prove that.
Exactly.
So this one, at least we do have data that's really encouraging. So I'd say the Clairvy is really popular. And in that kind of perimenopausal time where women are noticing a little change in their
hmm
vaginal scent and
Sure.
they want to take something, but they don't need an antibiotic, I
Right.
think that's
Right.
been really helpful. Yeah.
Right. Let me ask you about realizing.
Yeah.
Yeah, because this is what I'm seeing a lot of. Of course, I'm
Yeah.
seeing a ton of, vaginitis or that we think is
Yeah.
vaginitis, but, sometimes just isn't. It's just, due to lower estrogen levels and the
Right.
changes that
Right.
ensue as
Right.
a result of that. But talk to me about realizing and how effective that is compared to just everything else that's on the market, whether it's, traditional estrogen and progesterone, or
Yeah.
whether it's, compared to some of the, like the newer stuff like the neurokinins or,
Right.
some of the other, things that we're using, for hot flash treatment.
Sure. So, look, hormones work for this purpose 100%. I would say I don't have anybody who doesn't at least feel
Sure.
improved in hormone therapy. So let's just put that out there. We
Sure.
are in favor of hormones for those people who need them, want them, and are
Yes.
able to take them. The newer medication, for example, the fezolinetant, which is out, and the newer product that's still being studied, I can't really say that I have that much experience with
Sure.
this. Most of my patients either can't get insurance coverage for it or might balk a little bit at having to have blood work done. Either way, I'm still waiting for the jury really to be out in real world practice about how that works. So let's talk about Relazin, which has been around for a very long time and been used in Europe for many, many more years than here in the US. This is essentially made from a Swedish flower pollen that has had the allergens removed.
Okay.
It is taken daily, and we know from our clinical studies that 65% of users find beneficial effect. It is not better than or even equal to hormone therapy, but
Mhm.
still 65% of women are responding, and that's great to know.
Yeah, that's
The
significant.
It is significant, and also no side effects that have really been reported of note. I mean,
Sure.
surely some people can be sensitive to any product, but really no adverse events that we can report. And the only I don't even want to call it a downside. It's just something that we have to set expectations properly. It takes a good 3 months to really notice its optimal effect. So when
Okay,
I put people on Relazin, I just tell them, look, you're going to need to be patient, put a mark on your calendar, but by 8 to 12 weeks, you really should be feeling improved. And I find that
sure,
people are really happy. The other thing that people are appreciative of is that there's no bleeding habit changes. So if you're already menopausal and trying to manage your vasomotor symptoms, it's not like hormone therapy where you may start bleeding again
sure,
and have all that worry. So that's another real benefit of Relazin. How long do people take it? As long as they need it. We do notice that when people come off, they may have a recurrence of symptoms and then we'll go
sure.
back. So similar to hormones or probably any other medication. I will say we always mix this with lifestyle management tools,
Mhm.
dietary changes, exercise, stress reduction, avoidance of things that may be triggers. I mean,
Right.
everything that I'm sure we're all telling our patients on
Mhm.
a day-to-day. So,
Yeah, I
yeah.
think that people don't really quite realize just the impact that lifestyle modification can have on these symptoms. Whether it's, dietary modifications. And I never tell
Yeah.
patients to diet. I just say make better choices.
Yeah.
Staying adequately hydrated, making sure that you are getting enough rest. And then
Yes.
frankly, just having, a good outlet for stress relief because the impact that stressors can have on your body can just
Yeah.
manifest in so many different ways. So I'm really actually happy that you mentioned that.
Yeah, well, listen, I think it's there's a package and we have to really impart upon people that the whole package is important. I know that, some people have specific triggers like alcohol or spicy
Sure.
food or large meals or big sugar
Hmm.
loads. And these are also things we talk about. I mean, I'm a huge fan of the Mediterranean diet,
Hmm.
as a lifestyle, not as
Sure.
like a diet you go on
Right,
necessarily
right,
to lose
right.
weight, and then exercise for sure.
For sure. Let me ask you this. Cost wise, have they done like any head-to-head analysis like about treating menopausal symptoms using the bonafide products versus traditional? Like what are people going to pay out of pocket for this as opposed to
Oh,
the
cost
traditional
wise,
therapies?
I can't really, I would say the cost of a subscription pack, which most people will opt into because,
Hmm.
we're recommending at least three
Sure.
months of use before you notice an effect, at least with Relazin.
Hmm.
It's usually between like 32 to $40 a month. There's always like these coupon codes and all healthcare provider codes that can be used to help defray some costs. But another thing that's really helpful would be the FSA and HSA accounts, which oftentimes will cover a fair
Uh-huh.
portion of these costs. So it's not covered by traditional insurance, of course.
Yeah, but what I was going to say to you is that I found that none of the patients that I have on this um, have had any issues with cost, which has been frankly quite reassuring.
Yeah, I mean, this could be also because we're both in the Northeast and it just seems like everything is somewhat costly up here. But
Right, right, right,
uh,
right.
I think the bottom line is if people are feeling so much better and their quality of life is really improving, my patients say the same thing, that that's not really not their primary concern. They just want to feel good and, manage their symptoms.
Sure. So one of the other things that I found really fascinating about you, I mean, number one, you're board certified practicing gynecologist, but you also are an author. And I was looking at,
Yeah.
your resume, and I saw your V is for vagina.
Yes, well, I am joining you in the author club. So yeah, a little funny story. My very first book was put out before it was cool to say vagina on the airwaves. So
Hmm.
V is for vagina. I would make it to a green room and then all of a sudden be told, I'm sorry, we can't like show the cover of your book on the air because it's morning TV and we don't know who will be. So we actually updated the book a couple of years later and enhanced it, wrote a
Sure.
whole lot more in addition, and renamed it the complete A to Z for your V. So we had to euphemize that word because people just still weren't ready for prime time usage, which kills me because
Yes,
we're gynecologists, of course we're going to use the word vagina. So
exactly.
but yeah, this was a really, really fun book. We always say that it is appropriate for women 18 to 80. And I think the question I really wanted to answer for people in this book was, am I normal?
Hmm.
Because This is the question I get all day, every day, and it's not just from
Right, right.
menopausal patients, it's from anybody of all ages. Is this normal? Is it normal that this is my bleeding habit? Is it normal I'm having a hot flash? Is it normal
Mhm.
I don't want to have sex this many times a
Sure,
month? Whatever it is. So we
sure.
really go into all kinds of gynecologic topics.
So let me ask you this. What do you think are the top three misconceptions that you come across about vaginas? So
Oh,
misconceptions versus what the reality is.
yeah. Okay. So I think misconception number one, which we have already touched upon, is about how you need to clean your genital area. And oh my gosh, some of the regimens that have
I
been passed
know.
down through generations from, relatives or friends or these crazy internet crazes,
Mhm.
that's something that I think is a misconception. So I'm sure you'll agree that the vagina, the inside, does not
Yes.
need vigorous loofah scrubbing with, any
Right. Or
particular
steaming.
or
That.
steaming
Right, right,
or
right.
chemicals for
Hmm.
that matter, but really has mechanisms to clean itself. And when
Absolutely.
things feel off, whether it's in the scent or itching or discharge,
Hmm.
a probiotic might be helpful, or
Right,
getting checked out for an infection and
right.
treating that might be helpful, or looking into all products you're using to see whether something is
Hmm.
causing a sensitivity. And then there's, of course, the vulva, which I just wish would get a little bit more attention.
I
But the
know.
vulva is everything on the outside, as you know.
Yes.
I
And
think
people seem to think that we can use these terms interchangeably.
yes. So maybe that should be misconception number two. Not only the washing of the genitals and how to keep things clean, but
Hmm.
the nomenclature, the
Sure.
vulva and vagina are not necessarily the same thing.
Right,
Yeah.
right.
And a third misconception, I think I'm just going to put a positive spin on this. Menopause does not have to be a Debbie Downer, miserable situation. There
Hmm.
is absolutely no reason that it can't be faced with, a proactive approach. And but some people feel at the top of their game at this time of life.
Yeah, I'm actually really happy that you said that because I feel like the whole perception of menopause and, it's all downhill from here,
Yeah.
is just really just not what it has to be. I mean,
Agreed.
frankly, being someone that's in this stage, that stage of life, I
Mhm.
frankly feel like, I'm like living my best life right now,
Yeah.
you know.
Yeah.
So I'm really happy that, we're now able to kind of enlighten people and, give this more of a positive spin. Your
Yeah.
sexual life and health doesn't have to be over,
No,
and
it may be
frankly,
different. Yeah.
exactly. It may be different, but
Yeah.
really the best, as far as I'm concerned, is yet to come. You're just really kind of getting started,
Yeah.
if
Yeah.
you will. So sex, you kind of let me into that.
Yeah.
And it can be different. You wrote another book. You're
Yes.
busy on this writing thing.
My hands are tired from all the typing. This book actually was meant as a very brief guide, perhaps for patients, but also for other healthcare providers
Sure,
who may just want a little introduction into how to, exercises and methods to help with your sexual spark,
sure.
if you will. So that's the name of the book, is The Sexual Spark.
Yeah,
And essentially it goes through so many different subjects and variables that might have association negatively or
sure.
positively with your sexual life. So of course, we talk about, and I wrote this with a colleague of mine who's also an OB/GYN and a world-renowned expert in sexual health.
Sure.
So it's a very simply written book, but it talks about taking care of chronic medical issues, because
Right,
that's going to have bearing on sexual life.
right.
Dealing with blood flow issues, of course, managing sexual pain and vaginal dryness. We talk
Sure,
about how to consider exercises to spice up your relationship a little bit, even in
hmm,
a happy relationship,
sure.
or whether, we always talk about the husbandectomy if you need to,
Right,
see a counselor or a
right.
couple therapist to assist with relationship issues. So, it just really goes through a lot of basics and exercises and things that can be done to help to
Sure.
spark some more sexual pleasure in your life.
So let me ask you this, because this is kind of one of the things that you're really passionate about, female sexual health and
Mhm.
then medical sex therapy. Talk to me a little bit about that and how you incorporate that into
Yeah.
your practice. Like, what does that mean for you?
Yeah. Well, I wanted to distinguish myself from the wonderful mental health professionals who practice traditional sex therapy with
Sure,
their patients. I am not an expert in that way, although I did get a lot of education on that,
sure.
but I'm not a mental health expert. So I have colleagues that I refer to in the mental health space to help with that angle of sexual health. Medical sex therapy, I really define more about the gynecologic and medical issues that may be
Sure,
interfering with somebody's pleasure. So, for example, I mean, we've touched upon vaginal pain,
sure,
dryness, and menopausal and hormonal changes that may really impair somebody's ability to have pleasure during sexual activity. So, whether this means aggressive moisturizers or lubricants,
hmm,
or some sort of hormonal therapy, or dilator therapy to
sure.
help with, mechanical stretching of the vagina, and also that mental component of anticipating pain and managing
Right,
that. Whether I bring in vibrator use on a
right.
medical level to help enhance blood flow to the genital tissue. So that's one angle of medical sex therapy.
Sure,
Obviously, and I always hate to have to even bring up this subject matter, but people who have had, issues with trauma or abuse in the
sure,
past,
sure,
I will work alongside a mental health specialist to really assist somebody to try to really navigate that so that they can better enjoy a healthy and trusting sexual
sure.
relationship with a person or on their own in future. Medical sex therapy also involves medical issues. So, for example, we see so many autoimmune diseases,
Sure,
arthritis, and things that impair mobility, or joint pain, or things of that nature, as a medical issue. So
sure.
managing that as it relates to sexual health. And then, of course, the cancer patient and the cancer survivor. These
Absolutely.
women have such special nuances that we really have to teach them the new normal and help them to navigate this with their partner, so that they can move on in a positive way. So does that kind of answer your
Oh my
question?
gosh, it like
Yeah,
beyond.
yeah,
You've
yeah,
really kind of touch base on like a wide variety of things, not just menopause, but just certainly how other conditions, whether, there are other medical ailments, certainly not just physical, but also mental
yeah.
things can impact kind of this
Yeah,
phase of life.
I also really like to, two things that come to mind. Number one, sexual function and pleasure may ebb and flow
Hmm.
through people's
Sure.
lifetimes, so there may be months where nobody's interested because maybe there's a lot of stress going on personally
Right.
or professionally. Obviously, childbirth has a lot to do with sexual function and
Right.
getting back in the saddle with that, treatments for medical issues. So I think education is so important here because this all goes back to what I said before about my book, which is what is normal.
Right.
Because, if you just watch movies or TV or soap operas or whatever it is, you may think that what's normal is, oh my God, having earth-shattering sexual
Right. Right.
relations
Right.
on a
Right.
daily basis. And that's just not real life for the
Right.
majority of people. So education is also really important. There is a website that was developed by a colleague of ours. Her name is Dr. Lindsay Harper, and the website is called Rosie.
Uh-huh.
It's probably been around for a couple of years now, but it's fantastic to help with sexual function, sexual education, counseling, resources. So at this point, it has saved me a lot of discussion to be
Sure.
able to push my patients into the direction of that site to get more education.
How are they spelling Rosie?
ROSY.
Okay. All right.
Yeah.
See, I would have immediately gone to IE.
It's definitely ROSY. Yeah. Rosie.com.
All right. That's a fantastic resource. So let me ask you this, and just because I'm going to kind of wrap it up.
Yeah.
What are your top three kind of pointers that you like to leave people with? I'm going to start with just on menopause in general, and then, frankly, I also want you to just leave people three bullet points on the Bonafide products, which I frankly think are fantastic.
Yeah, thank you. I do too, or I wouldn't be in the
Yeah,
position I'm in. Mhm.
sure.
Yeah. Well, look, I think Reverie, which is the hyaluronic acid vaginal insert, is an absolute game changer for so many patients, particularly those who just do not feel that they want to or can use vaginal estrogen comfortably. So I think that is one pointer. And my bullet point would be, do not suffer without trying to, get assistance, be proactive, and get educated on the subject matter of sexual pain or or rather menopausal vaginal changes, because this is something that can be addressed, and it's best to be addressed earlier rather than later.
Yep.
Yeah. I don't want this to be a sales pitch for all Bonafide products, but I think, again, so many women really have self-esteem issues being concerned about vaginal odor.
Sure.
So get checked out. Check out all your products to make sure nothing is, you're using is causing sensitivity. Make sure there's no infection, and consider Clairvy, because we really do have
Yeah.
pretty good clinical study on that. And then hot flashes, night sweats. There is such a variety of potential products to assist. Don't suffer. We need sleep. We need to be comfortable during the day.
Right.
We need to be comfortable at work and in our personal lives. So with either Relazin or some other product, really address hot flashes and night sweats. There's just at this point no reason to suffer.
Sure. And
Yeah.
frankly, this is completely not a sales pitch, but one of the reasons that I really wanted you on is because I really did want you to speak to these products. Number one, because a lot of women, again, are looking for just something different,
Yeah.
for whatever reason, whether they have
Yes.
contraindications to traditional hormone therapy, or whether they just are more, some women are just more, and I'm using an air quote, natural. They just
Yeah.
don't want
Yeah.
hormones. So I'm really happy that you were able to come on and just kind of frankly give an overview of the products,
Yeah.
the efficacy. And, I certainly can attest to, I have a lot of patients that use these products with great success. Specifically, the hyaluronic acid has been a game changer and a nice alternative, but I'm going to even just speak to the probiotic and just, the constant, even in non-menopausal women, the issues that, some patients have with recurrent vaginitis, whether it's yeast, whether it's BV. This is a nice alternative. And it's nice to be able to give somebody a go-to and say, not just, a gut probiotic,
Yeah.
or, just take
It's
this for
more
animal. It's
focused.
nice to have something that's more focused, that has actually proven efficacy.
Yeah, so that's where I really was going to leave this, is that I, as a traditionally trained physician,
Sure.
feel really comfortable with the studies that are available on these products, because, some of the supplements out there really can be the Wild West. And so
Yes.
these have really, good studies behind them to make me feel comfortable.
Yes. And I just really wanted to say to you, thank you so much for destigmatizing a lot of this. I mean, your book, Vagina from A to Z, V for vagina. I just like to say the word vagina because that's what it is. And we need
You
to
and
be
me
saying it
both.
more often. But it's just, women need to know, number one, you are not the only one that is going through this. And number two, there are a wealth of resources and options that are available to you to treat whatever it is that you are going through. So,
Absolutely.
just thank you so much for, for speaking to that, and just for your work in the realm of, development and helping to get, more products out on the market, that women can be aware about and have access to treat, this stage in our life.
It is my pleasure. Thank you so much. And for more information, definitely visit Bonafide, hellobonafide.com, because there's just a wealth of information that's medically vetted and really, really helpful for people just to learn about themselves.
Yes. Yes.
Yeah.
So in closing, I just want to say thank you so much, Dr. Dweck, for agreeing to be on the show. You provided like a wealth of information and really kind of a very fun and relatable kind of way. And just keep doing what you're doing. Until next time, everybody stay well, stay healthy, be happy. As per usual, I always close the show with a quote from some book that I have on my desk. This book that I use a lot is actually a book that I got when I graduated from college, and it just has like a ton of like inspirational quotes. So if I'm telling you that I had this book when I was in college, it's old because I'm old. It's like I'm an old gal. But anyway, today's quote says, "We all start out in life with one thing in common. We all have the same amount of time. It's just a matter of what we do with it. So invest your time wisely, because it's not something that you can take back." So until next time, stay happy. I cannot wait to reconnect with you as we continue the menopause series. Y'all know where to find me, www.askdrangela.com. That's AskDrangela.com. There you can find all my social media connections on Instagram, Ask Dr. Angela, Facebook, Ask Dr. Angela, and, formerly Twitter. Guess what? Ask Dr. Angela. But until next time, be well, and just thank you so much for tuning in.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness, and does not and should not replace treatment from a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at AskDrAngela.com/terms.